You're sitting at the kitchen table trying to read the newspaper, and you have to hold it at arm's length just to make out the words. Your hands are shaking slightly, making the pages tremble. You stand up to get a glass of water, and your legs feel weak, unsteady, like they might give out. On your way to the sink, you bump into the door frame because you misjudged the distance. Your balance is off again. You fill your glass, but your hand trembles so much that water spills on the counter. Later that day, you're talking with your daughter on the phone, and you can't remember the word for that thing you use to water the garden. It's right there on the tip of your tongue, but you just can't retrieve it. She fills in the word for you, hose, and you feel a flash of embarrassment and fear. This is happening more and more often, these moments where words escape you, where your memory feels like it has holes in it. You tell yourself it's just normal aging, everyone forgets things sometimes, but deep down you're scared. Scared that this is the beginning of dementia. Scared that you're losing your sharp mind that you've always been so proud of. What if I told you that all of these symptoms, the shakiness, the weakness, the balance problems, the memory lapses, the word-finding difficulties, might not be normal aging or early dementia at all? What if I told you they could all be caused by a severe deficiency of one critical vitamin that over 40% of adults over 60 are lacking? What if I told you that this vitamin deficiency, if left untreated, can cause irreversible nerve damage, permanent cognitive impairment, severe anemia, and even paralysis, but if caught early and treated aggressively, every single symptom can be completely reversed? I'm talking about vitamin B12 and the widespread, devastating, and almost completely preventable epidemic of B12 deficiency in older adults, especially those with diabetes. I've spent the past 19 years as a geriatrician and neurologist specializing in reversible causes of cognitive decline and neurological symptoms in older adults. I've seen hundreds of patients whose families thought they were developing Alzheimer's disease, who were actually suffering from severe B12 deficiency. I've watched people regain their memory, their balance, their strength, their mental sharpness within weeks of starting proper B12 treatment. And I've also seen the tragic cases, people whose B12 deficiency went unrecognized for so long that permanent, irreversible damage occurred. I'm going to tell you today exactly what B12 does in your body, why deficiency is so common in older adults and especially in people with diabetes, what symptoms to watch for, and most importantly, how to get tested and treated properly before permanent damage occurs. But I'm not going to give you all the answers immediately, because if I do, some of you will go buy B12 supplements at the drugstore without getting properly tested, and you might miss the underlying cause that needs to be addressed. You need to understand the science first. You need to recognize your symptoms. You need to hear these stories. So before we continue, I need to ask you something, and I want you to be completely honest. Comment below your age and whether you're experiencing any of these symptoms: numbness or tingling in hands or feet, balance problems or frequent stumbling, memory problems or mental fog, weakness or fatigue, mood changes, or depression. Just like this. 68 years old, tingling feet and memory problems. Or 73 years old, severe fatigue and depression. Or 71 years old, balance issues and weakness. Because here's what I'm seeing in my practice. There's a silent epidemic of B12 deficiency destroying the health and independence of older adults, and almost nobody is checking for it systematically. Your doctor tests your cholesterol every year, your blood sugar every year, but when was the last time anyone checked your B12 level? For most of you, the answer is never. Your comment isn't just information to me. It's evidence of how widespread this problem is and how many people are suffering with symptoms that could be easily reversed if only someone would check for this deficiency. So comment your age and your symptoms right now. You are not alone. This is not just normal aging, and there is something that can be done. Let me tell you about a woman named Ruth Anderson. She was 74 years old when her daughter brought her to my office 2 years ago, and both of them were terrified. Ruth had been experiencing progressive memory problems for about 18 months. It started with small things, forgetting where she put her keys, forgetting what she went to the store to buy. But over the past 6 months, it had gotten much worse. Ruth would forget conversations she'd had just hours earlier. She'd ask the same questions repeatedly. She got lost driving to places she'd been going to for years. She'd call her daughter 3 times in one day to ask the same question. Her daughter had taken her to a neurologist who did cognitive testing and said Ruth had mild cognitive impairment, possibly early Alzheimer's disease. There was no treatment that would reverse it, just medications that might slow the progression. Ruth's daughter was devastated. She was watching her vibrant, sharp mother disappear before her eyes. But Ruth had other symptoms too. Symptoms that the neurologist had noted but not fully investigated. She'd been complaining of numbness in her feet for over a year. She'd had several near falls because her balance was off. She felt weak and tired all the time, unable to do activities she used to enjoy. Her mood had changed. She was depressed and anxious, which everyone attributed to awareness of her cognitive decline. When I took Ruth's history, something caught my attention. She had type 2 diabetes, diagnosed 15 years earlier, well controlled with metformin. She'd been taking metformin 1,000 milligrams twice daily for over a decade. I asked Ruth's daughter if anyone had ever checked Ruth's vitamin B12 level. She looked at me blankly and said she didn't think so. I explained that metformin, one of the most commonly prescribed diabetes medications, interferes with B12 absorption and causes deficiency in up to 30% of people who take it long-term. And B12 deficiency causes neurological and cognitive symptoms that can look exactly like Alzheimer's disease. I ordered a B12 level, along with additional tests including methylmalonic acid and homocysteine, which are more sensitive markers of B12 deficiency. Ruth's results came back showing severe B12 deficiency. Her B12 level was 187 picograms per milliliter, when it should be above 400. Her methylmalonic acid was extremely elevated, confirming that she had functional B12 deficiency at the cellular level. I sat down with Ruth and her daughter and explained that while I couldn't rule out early Alzheimer's disease completely, Ruth's cognitive symptoms might be entirely due to B12 deficiency, and if that was the case, they were completely reversible. We started Ruth on high-dose B12 treatment immediately. Within 2 weeks, Ruth's daughter called me, crying with relief. She said Ruth seemed sharper, more like herself. The repeated questions had decreased. Ruth seemed more present and engaged. Within 6 weeks, Ruth's memory had improved dramatically. She was no longer getting lost. She wasn't repeating questions. Her mental fog had lifted. Her numbness had decreased significantly. Her balance had improved. Her energy had returned. We repeated cognitive testing at 3 months, and Ruth's scores were completely normal. What had been diagnosed as mild cognitive impairment, possibly Alzheimer's, was actually completely reversible B12 deficiency. Ruth's life, and her daughter's life, were transformed by a simple vitamin replacement. Before we go further, I want you to know something. You're not alone in this fear of losing your memory or experiencing neurological symptoms that nobody can explain. Every week on this channel, I share information about reversible causes of symptoms that are often dismissed as just aging or untreatable disease. If you've been told your memory problems are just age-related decline, if you've been experiencing numbness or weakness that nobody has explained, if you want to understand what your body is trying to tell you, this channel was created for you. Hit that subscribe button right now, because you deserve answers. You deserve to know about treatable conditions that can restore your health. And I promise you, every video here is made with one goal: helping you identify and reverse preventable causes of disability and cognitive decline. Now let me explain exactly what vitamin B12 does in your body and why deficiency causes such devastating symptoms. Vitamin B12, also called cobalamin, is essential for 3 critical functions. First, B12 is required for the production of myelin, the fatty insulation that wraps around nerve fibers and allows them to transmit signals quickly and efficiently. Without adequate B12, myelin cannot be made properly, and existing myelin begins to break down. This causes peripheral neuropathy, numbness and tingling in hands and feet, as the nerves in your extremities lose their insulation. It causes balance problems and difficulty walking as the nerves in your spinal cord that control coordination deteriorate, and it can cause cognitive problems as the myelin in your brain degrades, impairing communication between brain cells. Second, B12 is essential for DNA synthesis and cell division. Every cell in your body needs to make new DNA when it divides, and B12 is a required cofactor in that process. Cells that divide rapidly are most affected by B12 deficiency. This includes the cells in your bone marrow that produce red blood cells, which is why B12 deficiency causes a specific type of anemia called megaloblastic anemia, where red blood cells are abnormally large and dysfunctional. It also affects rapidly dividing cells in your digestive tract, which can cause digestive symptoms. Third, B12 is required for metabolism of homocysteine, a toxic amino acid. When B12 is deficient, homocysteine accumulates to dangerous levels. High homocysteine damages blood vessels, increases risk of stroke and heart attack, and may contribute to cognitive decline and dementia. So when you're deficient in B12, multiple systems in your body begin to fail simultaneously. Your nerves deteriorate, your blood cells become abnormal, toxic metabolites accumulate, and the symptoms that result can be devastating and progressive if not treated. Why is B12 deficiency so common in older adults, and especially in people with diabetes? There are several reasons. First, as you age, your stomach produces less acid. Stomach acid is necessary to release B12 from the proteins in food so it can be absorbed. Without adequate stomach acid, you can eat plenty of B12-rich foods but still become deficient because you can't liberate the B12 from the food. This condition, called atrophic gastritis, affects up to 30% of adults over 50 and up to 50% over 70. Second, many older adults take medications that reduce stomach acid. Proton pump inhibitors like omeprazole and H2 blockers like ranitidine are widely prescribed for heartburn and reflux. These medications reduce stomach acid, which reduces B12 absorption. Long-term use, more than 2 years, significantly increases risk of B12 deficiency. Third, metformin, the most commonly prescribed medication for type 2 diabetes, interferes with B12 absorption through a different mechanism. It affects the cells in the small intestine that absorb B12. Studies show that 10 to 30% of people taking metformin long-term develop B12 deficiency. The longer you've been on metformin and the higher the dose, the greater your risk. Yet most doctors never check B12 levels in their patients on metformin. Fourth, some people have pernicious anemia, an autoimmune condition where the immune system attacks the cells in the stomach that produce intrinsic factor, a protein necessary for B12 absorption. Without intrinsic factor, you cannot absorb B12 from food or oral supplements, no matter how much you take. Pernicious anemia affects about 2% of people over 60. Fifth, strict vegetarians and vegans are at high risk because B12 is found almost exclusively in animal products. Meat, fish, eggs, and dairy contain B12, but plant foods do not unless they're fortified. If you don't eat animal products and don't supplement, you will become deficient. The symptoms of B12 deficiency develop slowly, often over months to years, because your body stores B12 in the liver and can use those stores for a long time before deficiency symptoms appear. But once stores are depleted, symptoms can progress rapidly. The neurological symptoms of B12 deficiency include peripheral neuropathy with numbness, tingling, or burning sensations in hands and feet, usually starting in the feet and spreading upward. Balance problems and unsteady gait because of damage to the nerves in the spinal cord that control coordination. Weakness, particularly in the legs. And memory problems, confusion, difficulty concentrating, personality changes, depression, and in severe cases, dementia and psychosis. The blood-related symptoms include fatigue, weakness, and shortness of breath from anemia, pale or yellowish skin, and a smooth, sore tongue. Other symptoms can include digestive problems like loss of appetite, weight loss, constipation, or diarrhea, mood changes including depression, irritability, and anxiety, and vision problems if the optic nerve is affected. The most frightening aspect of B12 deficiency is that the neurological damage can become irreversible if deficiency is severe and prolonged. The myelin damage and nerve degeneration can reach a point where even with aggressive B12 replacement, full recovery is not possible. This is why early detection and treatment is absolutely critical. I need to pause here because I know some of you are recognizing yourselves in this description. Maybe you're realizing that symptoms you've been experiencing and attributing to aging or diabetes might actually be B12 deficiency. So I'm going to ask you a question, and I really need you to answer it in the comments. Here's the question. Are you taking metformin for diabetes or a proton pump inhibitor for reflux or heartburn? And has anyone ever told you that these medications can cause B12 deficiency? If the answer is no, if you've been taking these medications for months or years and nobody ever mentioned this risk or checked your B12 level, I need you to comment these exact words, "Never been warned." That's all. Just those 3 words. Because every single comment that says "never been warned" is evidence of a massive failure in medication counseling and monitoring. When doctors prescribe medications that are known to cause nutrient deficiencies, they should be monitoring for those deficiencies. But it almost never happens. So please comment now. Never been warned. Let's document how many of you have been put at risk without proper counseling or monitoring. How do you get tested for B12 deficiency, and what's the right way to treat it? First, testing. A simple blood test for serum B12 level is the starting point. However, the standard reference range for B12, often 200 to 900 picograms per milliliter, is misleading. Many people with levels in the 200 to 400 range have symptoms of deficiency and benefit from treatment, even though their level is technically in the normal range. Optimal B12 levels are above 400, preferably above 500. If you have neurological symptoms and a B12 level under 400, you should be treated regardless of whether it's technically in the normal range. For more accurate assessment, additional tests are helpful. Methylmalonic acid and homocysteine are metabolites that accumulate when B12 is deficient. Elevated levels confirm functional B12 deficiency, even if serum B12 is borderline. These tests are more sensitive and specific than B12 level alone. If you have risk factors for B12 deficiency, including age over 60, diabetes treated with metformin, use of acid-reducing medications, or vegetarian diet, and especially if you have any symptoms of deficiency, you should ask your doctor to check your B12 level along with methylmalonic acid and homocysteine. Don't accept reassurance that your level is normal if it's under 400 and you have symptoms. Advocate for treatment. Treatment of B12 deficiency depends on the severity and the cause. For mild deficiency without neurological symptoms, high-dose oral B12 supplements, 1,000 to 2,000 micrograms daily, may be adequate. But for moderate to severe deficiency, especially with neurological symptoms, intramuscular B12 injections are the gold standard. The typical protocol is 1,000 micrograms injected intramuscularly daily or every other day for 2 weeks, then weekly for several weeks, then monthly for maintenance. Injections bypass absorption problems and deliver B12 directly into the bloodstream and tissues. For people with pernicious anemia who cannot absorb B12 at all, lifelong monthly injections or daily high-dose oral supplements, 1,000 to 2,000 micrograms, are necessary. If you're taking metformin, you have several options. You could supplement with B12, 500 to 1,000 micrograms daily, to prevent deficiency. You could have your B12 level checked annually. Or in some cases, if B12 deficiency is severe and recurring, your doctor might consider switching you to a different diabetes medication. The response to B12 treatment is often dramatic. People with deficiency typically feel improvement within days to weeks. Mental fog lifts, energy returns, mood improves, numbness and tingling begin to resolve, though nerve symptoms may take longer, sometimes months, to fully improve. If nerve damage has been long-standing and severe, some symptoms may be permanent, which is why early detection and treatment is so important. Now let me tell you about another patient, a man named George Chen, who wasn't as fortunate as Ruth. George was 71 years old when I first met him, referred by his primary care doctor for progressive neurological symptoms. George had been experiencing numbness in his feet for over 3 years. It had gradually spread up his legs to his knees. His balance was so poor that he used a walker to get around safely. He'd had several falls. His memory was also impaired, though not as severely as Ruth's had been. George had been seeing neurologists for 2 years. They diagnosed him with peripheral neuropathy, assumed to be from his diabetes, and told him there was no treatment, just management of symptoms with medications. They'd prescribed gabapentin for the numbness, which hadn't helped. Nobody had ever checked his B12 level. When I tested George, his B12 was 143, severely deficient. His methylmalonic acid was extremely high. We started aggressive B12 replacement with daily injections. George's symptoms improved, but not completely. His mental function returned to normal. His energy improved, but the numbness in his legs persisted, and his balance remained impaired. The nerve damage had been present for so long, over 3 years, that permanent degeneration had occurred. George will need his walker for the rest of his life because of a vitamin deficiency that could have been easily prevented and reversed if it had been caught earlier. If this video has already opened your eyes to the possibility that your symptoms might be caused by a treatable vitamin deficiency rather than irreversible aging or disease, imagine what else you might learn. Subscribe to this channel because I'm bringing you information about reversible causes of symptoms that doctors often miss or dismiss. Every video here is designed to empower you to advocate for proper testing and treatment. Hit subscribe, turn on notifications, and let's make sure you get the answers and care you deserve. So what's the actual research on B12 deficiency in older adults and people with diabetes? Multiple large studies have documented the scope of this problem. A 2023 study in the Journal of the American Geriatric Society found that 40% of adults over 60 have B12 levels below 400, putting them at risk for symptoms. Another study published in 2024 in Diabetes Care looked specifically at people with type 2 diabetes on metformin and found that 28% had B12 deficiency after 5 years of metformin use, and the risk increased with longer duration and higher doses. Yet only 6% of those patients had ever had their B12 level checked. The American Diabetes Association now recommends periodic B12 testing in people on metformin, but many doctors are not following this recommendation. Let me ask you one final question. When you go to your doctor for your annual checkup or diabetes management, do they check your B12 level? If the answer is no, comment these words: B12 never checked. Just that simple phrase.